Notice that the auricular surface of the sacrum fits to the similar surface on the ilium, and so that's one half, that's the right sacroiliac joint. And so when a person looks at the backside of another person, a lot of times there's kind of a dimple right there, and it's created by this joint, the sacroiliac joint. By the way, besides a lumbar disc problem or a low back problem, the sacroiliac joint is also a source of low back pain for people. So as a chiropractor, it's my job to try to figure out which is which. And sometimes it can be both. There's no law stating that a person can only have one problem at a time. Since I'm talking about it, let's talk about the relation of the sacrum to the fifth lumbar. Notice that the superior articular surfaces interface with the inferior articular surfaces on the fifth lumbar. And remember that the whole spine is pivoted or levered around this pivot point. So the fifth lumbar and the fourth lumbar oftentimes are the discs, the two discs that can be in trouble. When a person leans over, the force multiplied down here at the fifth and the fourth lumbar disc can be around 1,000 to 2,000 pounds of pressure. So you can easily see how that if this disc in between gets squished any certain way, if there's a misalignment posteriorward, it's going to put more pressure on the back, less on the front, and the disc is going to start squirting one way or the other. And remember too that the nerves come out in this hole. So if the disc happens to squirt toward that foramina there, where that nerve comes out, then whatever that nerve serves is going to be unhappy. That's sciatica in a lot of people. Pain, nerve pain down the leg. While I'm at it, let me talk about what we do in chiropractic. One of the chief problems in chiropractic is that the vertebra gets misaligned posteriorward like this. And so one of the jobs that we have is just to reposition it anteriorward so that the fifth lumbar vertebra will be repositioned correctly on top of the sacrum here. Some of the inflammation recedes after the proper apposition of these two bones takes place, and the person kind of slowly begins to feel better. There are times when the parts of the disc will fragment and will kind of go out what's called a neural sleeve, and will get stuck in a little kind of a pipe thing, and in that case a chiropractic adjustment's not going to fix that. So there are some times when the problem can be bad enough that a chiropractic adjustment is not going to be enough to do something positive. I actually have had several people who had this problem, a disc fragment, and they got up from the table, they felt better, walked down the hall, and felt worse within seconds because the fragment moved right back to where it was. So temporary relief for seconds that didn't last. That's a pretty good sign of a fragment as far as my clinical experience. Let's talk about just features on the sacrum for just a few minutes instead of how they articulate with other bones. This is the dorsal aspect. Notice that the coccyx is forward. In other words, there's a kind of a kyphotic curve in the sacrum. Remember that the coccyx does attach through musculature to the anus, so a broken coccyx can produce pain when going to the bathroom. There are 4 or 5, anywhere 3 to 5 segments in the coccyx, and on a lateral picture of an x-ray, if the coccyx is fractured, it'll be bent forward in an unnatural position that doesn't follow the normal curve of the sacrum. That's one sure way to see that a problem has happened there. The median sacral crest goes right down the middle, and this is analogous to the spinous process in the vertebrae. There are dorsal sacral foramina. The wings of the sacrum, whether we look from back or front, are called the ala. This is the base or the articular surface for the fifth lumbar. L5, S1 joint is what this is called. As I said earlier, one of the more common discs to be affected in the human because of our vertical upright bipedal posture, there's a massive amount of pressure that gets placed on this disc in upright posture. S1, S2, S3, S4, S5. I have heard of some research saying that misalignment of the S1 or S2 segment can lead to hyperactivity. That has kind of been on the books for probably 20 or 30 years in chiropractic. That's been a commonly researched entity. These are the ventral sacral foramina. Remember, I think I said this a minute ago, but remember that whenever a person is viewed from behind, the sacroiliac joint creates a dimple here in a person's low back. And I do see oftentimes clinically when people have a problem with the sacroiliac or the fifth lumbar, the L5S1 joint, that there will be pooling, swelling in this area, and the tissue is just kind of puffy and tender to the touch. Thank you, sir. One more addition to the thinking for the sacroiliac joint. I don't have the other innominate bone, but what happens is when you or I walk, the femur fits into the acetabulum, and it creates a figure eight type motion like this. Both ilia will actually pivot around the sacrum. For a long time, people thought that this joint was immovable, but we know that it is not immovable. You don't walk like this, a pure leg movement. It's an entire locomotor chain issue. It's from the foot to the knee to the low back, and that's one of the reasons why we talked last week about how that if in the arch of the foot that medial arch has dropped, causes the knee to knock inward and causes a problem all the way in the low back, may cause a short leg on the same side, and then when there's uneven pressure on the low back, then this causes low back pain. So sometimes alleviating the low back problem is as simple as correcting the foot issue, the dropped arch. Another thing to remember is that when we say S1, S2, S3, S4, S5, we're saying sacral segment 1, sacral 2, sacral 3. The lumbar vertebrae have an L designation. There are 5 of them, L1 through L5. The thoracic bones, which have a really sharp downward angulation, backward angulation of the spinous process, these are T vertebrae. They're usually 12, T1 through 12. And then the cervical vertebrae are those that support the head and the neck, and this is not a complete set, but when we look at the cervical vertebrae, we can notice that there are holes, there are transverse foramen in all of these. That's one way to tell cervical vertebrae apart from the others. Also, there are some special vertebrae. There's the atlas, which rotates around the odontoid process of the axis. It's kind of a special neck bone. And then the C2 vertebra is special because it has this pivot point. All the other ones do not have that. They just have a central disc area. So the atlas is the C1 vertebra, and then the axis would be C2, and in C3 there are typically 7 cervical vertebrae. That is true. The head, as it sits on top of the atlas, because of the shape of these lateral masses, the head typically just rocks this direction, like a nodding action, yes, no, on top of this joint. But then it is the relation of the atlas to the axis that produces head rotation right and left. You can see that. So clinically, as a chiropractor, if I have somebody say, it hurts to turn my head to the left, then I would automatically want to check between the atlas and axis and see if there's fixation here.